Hello everyone, this is Dr. Amit here. Today I want to discuss about the clinical mechanics of pectoralis minor muscle. Pec minor is a very mysterious kind of a muscle and is the major cause of pain around the shoulder region, around the neck region, around the thoracic region, as well as down to the lower back region, and it also sometimes alter the breathing pattern. So it causes a breathing dysfunction in some patients. So I refer pec minor as the muscle which is the king of dysfunctions. So pectoralis minor is the king of dysfunction. So what happened is कि computer professionals are sitting all day in front of their laptops and they develop this kind of a forward head posture. Dentists develop forward head posture, even physiotherapists develop while treating their patients, mostly in the slouched position. They develop forward head posture, surgeons develop forward head posture, school teachers and professors develop forward head posture. So what happens when we develop forward head posture? Pectoralis minor muscle tend to shorten. So when pectoralis minor shorten, just understand that the origin of the pec minor is from the 3rd, 4th and 5th ribs, and it is going to the coracoid process. So when it is going to shorten, it is going to decrease the distance between the rib cage and the scapula. So scapula will come closer to the rib cage and you can hear scapulothoracic crepitus. The patients who are suffering with pec minor tightness or shortening or contracture might also suffer with scapulothoracic crepitus. So this is one of the important evaluation test for diagnosing clinically whether the patient is suffering with pec minor tightness or not. So when pec minor is shortened, your scapula comes into protracted position, you develop forward head posture and rounded shoulders. This is rounded shoulder and forward head posture. So what will happen? The scapula goes into protraction and the retractors get inhibited. Retractors are medial trapezius and rhomboids. So they will get inhibited, and hence as a result, inhibition of medial trapezius and rhomboids, levator scapula, the muscle that is originating from the you can say superior angle of the scapula and inserting into the transverse process of the C1 and C2 vertebra, that gets tightened. So that gets tight and it compresses the occipital nerve, and the patient suffers with occipital neuralgia and cervicogenic headache and dizziness, so pressure over the eyes. So these kind of symptoms, upper cervical instability tends to occur due to you can say shortening of the or the tightness of the pec minor. So one is this cause, that pec minor may be the hidden cause of your dizziness or vertigo, or you can say cervicogenic headaches. Second is the other function of the pectoralis minor is that it is the downward rotator of scapula, and we know that the upward rotation of the scapula is caused by serratus anterior. So when pec minor becomes tight, it moves the scapula into the downward rotating position, fixes the scapula there, and upward rotation becomes inhibited and serratus anterior का inhibition हो जाता है. If serratus anterior gets inhibited, your subacromial space or the space between the you can say coracoacromial arch, beneath the coracoacromial arch there is subacromial bursa, and the space beneath it becomes compromised, and you can develop rotator cuff tendinitis, impingement of the rotator cuff, as well as subacromial bursitis. So pec minor tightness can cause impingement, the second thing that we have to take into consideration while treating the patients who are having pain over their neck region or their shoulder region. The third function of the pec minor is that it is the internal rotator of the humerus. So it inhibits, when it gets tightened, it inhibits the external rotator of the humerus. External rotators are infraspinatus, your posterior deltoid, and your long head of biceps. So what will happen? These external rotators will get inhibited, and if posterior deltoid is inhibited, what is going to happen? Rounded shoulders, the patient will develop rounded shoulders, and shoulder extension will be less because posterior deltoid is the shoulder extensor. So shoulder extension जो है that will become a little more inhibited. So the patient is coming with forward head posture and rounded shoulders. So what will happen when posterior deltoid gets inhibited? The head of the humerus shifts slightly anterior in relation to the glenoid cavity, and the patient develops anterior instability of the shoulder. Can you imagine that pec minor being the cause for the anterior instability of the shoulder? Yes, it is. Pectoralis minor causes the anterior instability of the shoulder. Even it also causes the subluxation of the long head of biceps out of its, you can say, bicipital groove, and long head of biceps comes near to the medial head of the biceps, and long head of biceps gets subluxated out of its medial, out of its bicipital groove, and hence bicipital tendinitis can occur due to the tightness of pectoralis minor. So see the amount of conditions that are indirectly occurring due to the result of the over tightness of the pec minor. But what else pectoralis minor contributes? Now I am going to come to the neurokinetic chains. We have 3 kinetic chain systems in our body. Sometimes we classify them into 5 kinetic chains. But tightness of the pec minor along with the frontal kinetic chain or the diagonal kinetic chain, it is going to inhibit the ipsilateral psoas or the contralateral psoas, which is the hip flexor. Now, when pectoralis minor tightness, it works in connection with the frontal kinetic chain and inhibits it. So what will happen? The ipsilateral psoas is going to get inhibited, and when this pectoralis minor tightness in combination with the kinetic chain dysfunction, and when it combines with the diagonal kinetic chain or diagonal line, the contralateral psoas gets inhibited. So there will be a gait dysfunction which we will see in the patients. What is going to happen in those patients? Patients will walk with reduced backward swinging of the ipsilateral leg, contralateral arm, and reduced thoracic rotation of the ipsilateral spine, ipsilateral side of the arm. So what is going to happen? This gait dysfunction, if the patient is coming with this kind of gait dysfunction, you can analyze or you can assess that it might be the pec minor tightness. So pec minor tightness can cause gait dysfunction and inhibition of psoas muscle. So we have to be very cautious regarding pec minor tightness. We have to check for the gait dysfunctions as well. Last but not the least, pectoralis minor also causes breathing dysfunction. But it majorly causes breathing dysfunction if the scaliness is also tight along with pec minor. And when you are having forward head posture and rounded shoulders, your pec minor is also tight and your scaleni muscle is also tight. So check both of them. So if the scaleni muscle is also tight along with pec minor, what is going to happen? There will be an elevation of the rib cage. The depression of the rib cage will get reduced, and hence it is going to affect the inspiratory capacity of the lungs, and indirectly it is going to inhibit quadratus lumborum muscle. It is going to inhibit quadratus lumborum muscle. It is going to inhibit latissimus dorsi muscle, as forward head posture is assumed by the tightness of pec minor. What is going to happen? Latissimus dorsi is going to get inhibited because latissimus dorsi is shoulder extensor. But now the patient is in protracted shoulders. So lats is going to get inhibited, quadratus lumborum is going to inhibit it, and hence patient might experience low back pain symptoms. So I'm going to summarize it all. Pec minor tightness can cause inhibition of the medial trapezius rhomboids and may become the cause of cervicogenic headaches and occipital neuralgia, and you can say dizziness and atlantoaxial instability kind of things, upper cervical segmental dysfunction. It may become the cause of subacromial bursitis or the impingement of the rotator cuff tendons. It might become the cause of anterior instability of the shoulder, as well as you can say subluxation of the long head of biceps causing bicipital tendinitis. It might cause gait dysfunction in the individuals. It alters the breathing pattern. It hampers the latissimus dorsi and quadratus lumborum muscle, and hence indirectly it becomes the cause of low back pain. So my advice to my young physios and to my patients is, okay, every time When you are diagnosing your neck pain or your shoulder pain or your thoracic, mid-thoracic pain or your low back pain, do evaluate your pec minor, check whether pectoralis minor is tight or not. If it is, release it. I am going to make another video about how to release pectoralis minor efficiently with passive release techniques and active release techniques, but this has to be taken caution when we are seeing the patients in our clinics. Thank you all. Signing off, Dr. Amit. Thank you.